Ulcerative colitis and Crohn's disease are autoimmune disorders. While both are characterized by inflammatory bowels, there are several key differences between the two conditions. Parkview physician Dr. Sunil Reddy explains.
Our own body attacks our colon and makes it to get inflamed. Ulcerative colitis is restricted to the colon. The inflammation does not go beyond the colon. Sometimes people can get inflammation elsewhere in the body, like in the skin or in the bones. Those inflammations are different, but they are associated with ulcerative colitis. Crohn's disease, although it belongs to the same group as inflammatory bowel disease, the pattern of inflammation in Crohn's disease is different than ulcerative colitis. Small bowel and large bowel can both be involved in Crohn's disease.
How will you know if you're experiencing signs of ulcerative colitis or Crohn's?
So people usually have pain in the belly, rectal bleeding, constant diarrhea, weight loss, inability to eat well, and chronic or long-standing illness feeling. These are the usual symptoms and signs.
While doctors are still learning about these autoimmune diseases, genetics and good bacteria appear to play a significant role.
Genetic factors do play a strong role. In addition to that, we also think these days of the clean hypothesis, which means people who are not exposed to the general bacteria that reside in our bowel while growing up, they tend to be at risk for getting this inflammatory bowel disease. We don't see Crohn's disease in the third world countries, so that explains that there is certainly a role of this bacteria, the good bacteria, in preventing the disease.
For those at risk of Crohn's or ulcerative colitis based on family history and symptoms, Dr. Reddy recommends seeing a physician sooner rather than later to avoid complications.
We always keep a broad outlook and broad screen to check for these diseases. The testing involves some basic common blood tests and then a CT scan to check the bowel and also a colonoscopy to look inside the colon and see for ourselves if there is inflammation in the colon. We usually biopsy the colon and that kind of gives us the answers as to what kind of inflammation is there.
While a cure has not yet been found, Dr. Reddy emphasizes the importance of a persistent treatment plan.
People still can lead a really good quality of life by staying on top of the medicines, being really compliant with treatment, getting appropriate screening procedures done in time to prevent colon cancer, staying healthy, eating healthy, good physical activity. Focusing on the mental aspect, it's essential for people to talk to other patients. There are certainly good resources available online where you can discuss with other people who have similar problems. So that kind of gives a good mental approach so that the stress is not there. Essentially, a good follow-up with a closely associated GI doctor or a colorectal surgeon to stay on track of the problem itself, make sure the screening processes are done, prevent colon cancer. All this helps in taking care of these issues.
This has been Making the Rounds, brought to you by Parkview Health.